A very welcome to Pharmaball. Today we'll discuss on the novartis drug Alpelisib, which was previously approved for breast carcinoma. So it is the second indication that is being approved by US FDA. So previously it was known as PIK3CA. Now since it has a new indications, that is the PROS that is being approved for, so it has a new brand name. So let's see what exactly it is. So this drug's name is Bezois. Now the brand name is Bezois. It's a very rare disorder and it's the first drug to approve for this condition. The full form of process PIK3CA, that is a gene, the PIK3CA gene related overgrowth spectrum. It is approved for these conditions in select patients more than 2 years of age. And then it is, and what exactly is the PROS? It is a spectrum of rare conditions characterized by atypical overgrowth. That we have to remember, atypical overgrowths are there. There is because of anomalies in blood vessels, it affects the lymphatic system and as well as the other tissues. However, the main uniqueness of this trial is that it is not based on the traditional randomized control trials, but is based on some few case studies. And also, Novartis announced that it will support the patients with PROS through its various programs. So basically, PROS is a very rare disorder. You can see that it's 14 per million. So you can 14 per million is pretty less in number, and it occurs due to the problem in the gene, that is the PIK3CA gene, that is mutation in the PIK3CA gene. And as I mentioned, it is a group of rare disorder. It's not a single disorder, it's a group of rare disorders. It has various forms, for example, fibroadipose hyperplasia, Clove syndrome, megaencephaly malformation. It occurs it occurs in the brain also. Facial infiltrating lymphomatosis. So there are various forms apart from this, and it can take shape into various conditions for that. For example, you can see here there is some photos of these conditions. You can see there is overgrowth of the right leg here, the right foot. Here you can see the gap is more as compared to what we have commonly. This person has a right limb overgrowth, and this young kid baby has a hypertrophy of the left side of his face. So, what is the pathogenesis of this PROS condition? So it occurs, first of all, it occurs due to mutation in the PIK3CA gene. And what is the normal function of this gene? This gene provides instructions to the body to make a protein. Okay, this makes a protein that helps control the signaling of other proteins. So it makes a protein that signals the other proteins to grow, for the growth and the cell division and cell movement as well as cell survival. So if there is a mutation in the PIK3CA gene, this protein will not form, there will be no signal, and so there will be some abnormal in the cell growth as well as cell division. Okay. So if cells are dividing too quickly or if they survive longer, then they should overgrowth of that part of the body can occur. So basically, there we have you will find some more means replicating cells as compared to the normal one. So this there is some hypertrophy of the cells, and believe me, there is a difference between cancer and this hypertrophy. You have to check it out. So technically, this gene promotes various growth factors. Here you can see various growth factors that led to the overgrowth of the tissues. And again, this slide shows that based on the time of onset, it is early onset and late onset. Early onset, what happens is that it may affect various cells in the body during the development phase, and late onset it occurs in a segment of the body. So ultimately, you can see the tissue specific and localized. It has a this person has a this means one limb of the person is being affected, whereas this side, I mean, you can see the abdominal part, the limbs, the lower limb and upper limb as well as the brain is being affected. So this is a picture of a kid, and this is when she grew up to the age of 8 years. So she was born with thoracoabdominal large lymphangema covered by capillary malformation and hypertrophy of the left foot. Okay. Because of these things, ultimately with age there is a dorsal scoliosis because there will be some pressure in the spine and a progressive overgrowth of the fibroadipose tissue, many localized in the front in the left foot with evident central gap at the right foot. You can see here, right foot here, there is a central gap. That's what we see in the previous picture. That is the from the big toe to the second toe, there is a wide gap. Now, coming to the treatment, the only mode of treatment till now was surgery and sclerotherapy. Sclerotherapy, because if you see in the previous photos, that it has been explained that there might be some malformation in the capillary malformation, lymphangiomas. So, sclerotherapy in that case really helps. Now, coming to the uniqueness of this trial, it is not a randomized controlled trial. Okay, drug is approved based on a retrospective, non-interventional medical cert review of patient. Medical cert review of patient. So it's a retrospective data. The data are retrospective and it's not a prospective study. It is not a cohort study. So whatever, if the person is being given, receiving the patient with process is receiving more than one dose of ALP for more than 24 weeks. That is the cutoff date of 9 March 2020. This was published in September 2021. And they try to evaluate whether this person is responding or not. Patient with greater than 20% reduction from the treatment start is only the target of this condition. So if we have a big abnormality, so this only minimum 20% reductions will means as per the study data, it will say that okay, this drug is improving. And yes, normally it should not be 20%, but again, since there is no drug available right now for this cross, and surgery is not so means advisable because if it is a generalized condition, you cannot do surgery for the whole body. So a 20% mere improvement as part of the patient, I think, will be very helpful. Again, the thing is that you need to remember that this drug is being approved based on the accelerated approval program. And I will take another session for this, what exactly is the accelerated approval program. So there's a lot of things we need to understand. That is that when FDA granted a drug to be in the market based on accelerated approval program, so the company has the responsibility to gather more data. I don't know whether for this trial for this condition whether they have to go for RCT or not, but I believe that they will treat patients free of cost and try to get more data, and then again go to the FDA and showcase the data in that case. But again, they have some royalty that they need to collect the data in a certain span of time. And during that course, they can earn a little bit of money for that. So, as you mentioned, as you've seen that the primary objective was only 20% reduction, overall reduction. So it is achieved in 10 of patients, 10 out of 37, that is 27% of patients, they got this reduction. 3 and 4% imaging in baseline and week 24 showed some reduction in target lesion volume, as well as investigate the observed patient improvement in pain 90%. That is pretty good. Okay, in quality of life it will improve. Vascular malformation 79%, limb asymmetry 69%, and disseminated intravascular coagulation 55%. So this improvement were observed in a subset of patients across the study population. Total is n 57 who reported symptoms at baseline at week 24. So the point is that although they define as 20% of greater reduction in the sum of cross-target lesion volume, suppose if the patient, I believe so, from the patient point of view, that if anything that is relieving the pain around 90%, we have vascular malformation 79%, it may not be effective for all the pros conditions that the patient may have from the head to the limb. But if it can relieve in certain areas of the body, then it would be also great, because it's very difficult, painful for any patients to be like that. Adverse event, well, generally diarrhea, this is common in most of the drugs, so it's not a very great thing. Stomatitis and hyperglycemia, again, it is nothing compared to the condition that the patient is suffering. The most common grade, that is grade 3 and 4 adverse event was cellulitis. One adult case was considered treatment related. But again, I don't think that is very serious in a condition like PROS. So I believe you'd also like to know how exactly this drug alpelisib was approved earlier. So it was approved, that is in 2019, in combination with Falslodac, that is a brand name for fulvestrant, to treat postmenopausal. So that is important. It is not a postmenopausal women and men with something like ESR positive, ESR negative, okay, HER2 negative, as well as PIK3CA mutation positive in advanced or metastatic breast cancer. So along with this drug, means FDA also approved this test for to detect PIK3CA. That's very good, and that's it. So there are a lot of drugs now with for PIK3CA type of inhibitors drugs. You can you can pause and go to the names. So you can pause this slides once, because there are a lot of drugs. There's PIK3 inhibitors that is being in the current pipeline and in various phases of clinical trials. You can have a look in it to understand more about this class of drugs. So, ending this with a note that please like and subscribe my YouTube channel. This will inspire me to bring a lot more new interesting contents related to the world of pharmacology. Thank you.